Well, good evening everyone, and thank you for joining us today on this webinar. I'm speaking to you from Edinburgh. A little bit of background about myself. My name is Biju Krishnan, and I'm a general practitioner. For the last, I've been practicing for about 20 years or so. For the last 15 years, been very interested in cosmetic dentistry, especially minimally invasive cosmetic dentistry. And one thing that certainly helps me achieve those sort of minimally invasive results is to be able to move teeth prior to doing something else, doing any restorative work. So in that journey, we've gone through many variations on a theme of primarily moving teeth developed to enable us to do that. Really, CFAS was developed purely for cosmetic reasons, primarily because a lot of the systems that we had initially approached really approached things from an orthodontic viewpoint. And the idea with CFAS was to try and develop a cosmetic solution for patients really wanting a quick cosmetic result, but really aimed at general practice. Okay, so we'll dive straight in. Now. Okay, so let's just go straight into some of the applications. Now, I'm sure there's quite a wide range of people viewing this webinar. Some of you may be familiar with orthodontics. A lot of you, I assume, will be doing a fair amount of cosmetic dentistry. Some of you may already be using systems which allow you to move teeth safely in a general practice setting. This is the kind of thing that we can achieve with CFAS. Now, this is a bread and butter case. It's a typical case into my practice. This patient's in her early 20s, and she's concerned about this minimal sort of crowding. She actually approached me because she was looking at veneers. Now, veneers in this case, it's very doable, but it does involve some heavy prepping, especially of the upper right canine there and the upper left lateral. So, given the fact that she's been offered an orthodontic opinion, she doesn't really want conventional orthodontics. The quick fix for her was, but we were able to offer her another solution. And really, cosmetic orthodontics, this is where it really comes into its own.